Hello and welcome to the Winner Circle community. I'm your host, Dr. Sean. Let's continue the conversation we've been having on how you can win and how we can win together. Each week we're joined by a guest who not only cares about what's going on in our society, but who also has special expertise in where we can win in life. Today we're joined by Dr. Jennifer David.
Hi.
Dr. David, welcome to the Winner Circle.
Thank you for having me. It's such a pleasure to be here.
We need you. We need you. It's Melanoma Awareness Month, I'm learning.
It is, yes.
And we want to have some fun in the sun,
Yes,
and we
yes.
want to do it safely. So I'm really happy and excited to have you here and learn from you.
Thank you.
So Melanoma Awareness Month, how do we recognize that, and how do we make sure that we are going about life, but also taking care of ourselves? What do we do during this month?
Okay, the great question. So May is Melanoma and Skin Cancer Awareness Month. So it's a month where dermatologists and skin cancer organizations really ramp up our efforts to educate the public on the importance of early detection of skin cancers and, most importantly, prevention of skin cancers. Skin cancers are the most common cancers in the United States. 1 in 5 Americans will develop a skin cancer in their lifetime. But it's important because a lot of these can be prevented with adequate education on sun avoidance and sun protection and early detection through skin cancer screenings in office.
And so how do I know, and who should get an evaluation, a screening? I've never had one myself.
No?
No.
Yeah.
I'm admitting
Okay,
openly here, I've
okay.
never had such an evaluation. Who should get screened?
Excellent question, because most people don't know everyone needs to have a skin cancer screening. Everyone has skin.
Even me with my dark skin?
Yes.
Yeah? Okay.
So one of the most notable tragic stories of skin cancer is Bob Marley. He passed away of melanoma on his toe. So, people of color, we get skin cancers less commonly, that's true. Our melanin protects us from UV radiation, but it's not impossible. And a lot of skin cancers, such as melanoma, are you're genetically predisposed to developing them. So if you're not having your skin checked, especially areas like the bottoms of your feet, between your toes, your back, you might not know that you're developing a new lesion. And if you detect a skin cancer early enough, they are curable with surgery. So regardless of skin color or skin type, you need to get your skin evaluated once a year by a dermatologist, and also do monthly self-exams to look for any new lesions that may have popped up before your annual skin cancer screening.
You know, I just saw a post, one of my friends on social media, and she mentioned that she now had shaved her legs and shaved her arms, and now she was noticing things that were not there a year ago. So now, how does a person know if it represents a problem or not?
Sure. So you don't. So that's why I tell my patients when they come in to take what we do that day as a baseline. So if I do an evaluation, most of us get moles and sunspots and certain growths that come with aging and maturity, and most of them are benign. So it really takes that trained eye to distinguish which ones are not. So at your baseline exam, you'll know that anything that hadn't been addressed in regards to needing to be biopsied is normal. So you want to then take a monthly inventory, make sure none of those moles are rapidly changing. Yes. So what you want to do is we tell patients to look for the ABCDEs of skin lesions.
Okay.
So that's in that. Yeah. So A stands for asymmetry. So most benign growth should be symmetrical, means you create an imaginary line down the middle, and it should be even on both sides.
Okay.
Symmetrical on both sides.
Excellent.
B is border. All normal lesions or moles should have nice smooth borders. D is diameter, growing rapidly. If it grows twice the size in a short period of time, meaning a couple weeks to a couple months, that should be an alerting sign to see your dermatologist sooner. And E is evolution. Are just changes over time, or is it becoming symptomatic? Is it bleeding? Is it itchy? Things like that.
Okay. And I may have missed the C in there.
Yes, color.
Color.
I missed this. Thank you. So color.
Okay.
So most moles come in ranges of colors from light brown to dark brown. But if you notice the color changing, it was once a light brown and now it's very dark brown or black, or it was light brown and then there's black spots or dark brown spots scattered in between. That's another sign. So asymmetry, borders, color, diameter, and evolution.
Evolution. Okay.
The other easy trick is I always tell people the ugly duckling syndrome. If you see one mole that looks very different than the others, or a new one that looks very different, come in right away. So look
Okay.
for that ugly duckling.
So if our skin is changing and we're noticing new lesions, I think you said, or we don't know what it is, it's probably best just to get it evaluated and come see somebody.
Absolutely.
Yeah, okay. Now, and so what do you do? What's the process as a dermatologist? And I mean, after you've looked at it, and is it mostly just an evaluation, or are you going to, does it require any further imaging, or?
So when I evaluate patients in office, I have a special tool called a dermatoscope, and most dermatologists use those. It's a special tool that will magnify and polarize light. So we look for patterns that are either reassuring and say, oh, okay, this is a benign lesion, or patterns and color changes that heighten our suspicions, and that prompts us to do a biopsy. So if it is something that's of concern, we do a biopsy. It sounds much scarier than it is. It takes less than 5 minutes. We clean the area, a little bit of numbing, very similar to what the dentist uses. I hate needles myself, so I tend to, err on the side of just making sure patients are comfortable as possible. There are distraction techniques, so it's not always a painful procedure. And then we either do a little shave biopsy where we shave them all off and send it to the pathologist. They look under the microscope, and in about 2 weeks, we get a definitive answer. Was this a benign mole? Was it a typical mole, or was it skin cancer?
As you're talking about skin cancer, and I'm realizing even as a neurologist, and I've been practicing for 20 years and in the hospitals, I really haven't seen much skin cancer. I don't really know what it looks like, but what I mean by that is I don't know how severe it can be. I see people with liver cancer on a regular basis, lung cancer, colon cancer, brain cancer I see on a regular basis. I never see skin cancer, so I probably have this idea that how bad could it be if it's involving the skin?
So there are different types of skin cancer.
Okay.
The most common are what we call basal cell and squamous cell. Those are directly related to sun exposure, and you can prevent yourself from developing those. And they tend to grow very slowly. They tend to be more locally aggressive, meaning that you need to have them excised, but they don't spread to other parts of the body commonly. In rare cases, it can happen. But then you have things like melanoma. So melanoma is one of those where if it's not caught early enough, it tends to spread very rapidly. So
like where perhaps?
It can spread from the skin to your lymph nodes, and then from your lymph nodes to any organ in the body. That's why that early detection is key.
Sure. Okay. So it sounds like there's a pretty good range.
There is.
Something that can be taken care of.
Absolutely.
And completely, but also severe and devastating.
Exactly. So there are higher mortality rates associated with melanoma. And the rates are increasing. You were speaking of frequency. The rates over the last 30 years have doubled. From 1982 to 2011, they did a study, and the incidence of melanoma has doubled.
Okay.
So.
All right, well, we want to avoid that.
Yes.
Let's talk about how we can avoid it if we can. What's the most basic things we can do to avoid, I guess, exposure? How do we avoid exposure from the sun of all?
So the most basics of things are sun avoidance. You always want to seek shade, make sure you're wearing hats, wide brim hats to protect your face, and sunscreen.
Yes.
You want to protect your skin, especially the exposed areas, on a daily basis with sunscreen. There's not a one-size-fits-all to sunscreens, but there are certain basic things that you should keep in mind. So for all patients, it's SPF 30 or higher.
Okay.
There's really not a big difference between SPF 30, 50, and even 100, but there is a significant difference between an SPF 15 and a 30.
Okay.
So you want to make sure you just have the SPF 30, apply it every morning as part of the last step of your skincare routine. You wash your face, brush your teeth, put on your skincare products, makeup, and then sunscreen. But the other important factor is it only really lasts for about 3 hours.
Wow.
So reapplication is important. So if you're doing an outdoor activity for a long period of time, it's important to reapply. Or if you put on your sunscreen as your last step in your morning routine and then you're going for an evening run, then you have to reapply because it's not as effective at 4 p.m. if you're outdoors running as it was when you put it on at 8 a.m.
Okay. Now, these times that you're referring to, are they just the duration that the care lasts, or are these
Exactly.
times of the day that we're more likely to get exposed to the more dangerous rays?
Yes, so between the hours of 10 a.m. and 4 p.m., that's when the sun rays are the strongest.
Looks like all day.
Well, no, well, in the summer months, we are very fortunate where it stays light till about like 8:30, 9
Sure.
o'clock.
Okay.
So if you're doing activities such as running, biking, rowing, anything on like the water where you're getting lots of reflection, it's best to do it first thing in the morning before 10 a.m. or
Okay.
later in the evening.
Okay.
And if you're doing it midday because that's what your schedule affords, then just
Sure.
make sure you're wearing that sunscreen.
Okay. Now that you mention it, these are the times that I would be most likely to run and go outside anyway, early in the morning or late in the evening, so that's not too
Okay.
much of a hassle. So now, people that are working outside, then they really have to heed a lot of this. I mean, working and doing things regularly. What about here and there exposure? Let's say I don't go to the beach every day. I'm just going maybe 2-3 times a month. I'm sorry, 2 or 3 times a summer, like a lot of
Okay.
people. Are those the only times that I have to worry about it throughout the summer?
No. So there's something called incidental sun exposure.
Lord.
That's the sun we get every day
Okay.
that accumulates over our lifetime. So driving in our cars, believe it or not. This morning I drove in, it's a beautiful sunny day. I was driving across the bridge facing east and the sun was coming directly through my windshield. So I had about a nice 30-minute exposure of direct UV radiation through my windshield.
Wow.
And if you factor that in a commute that's over a course of 30 years, that adds up very quickly. And you won't see effects immediately. What you'll notice is if you're not wearing sunscreen regularly, say in your, through your teens, 20s, and 30s, when you're in your 50s, 60s, 70s, all of these skin cancers will start popping
My
up.
goodness.
Yes.
So cumulative effect, sort of.
Correct, correct.
So now, I wasn't thinking about my arms so much as to being exposed. Somehow I had this image of people getting it on their forehead or their nose or their ears or something like that.
So
You can get it anywhere?
You can get it anywhere, yeah. So
Just like you said, toes, I mean, of all
exactly.
places.
So melanoma is one of those ones that could pop up anywhere, especially if you're genetically predisposed. The basal cell and squamous cells, those are very much related to sun exposure. So they are most common on the nose, ears, face, hands. And those ones will look different. They won't look like pigmented moles. They'll be pimples that don't heal.
I see.
So, or like a spot that starts to bleed. It looks, you thought it was a pimple, a month goes by, it hasn't resolved, it's bleeding regularly. Those are signs of it potentially being a skin cancer, and that's when you would want to come in.
Interesting. And very important to know. I appreciate you sharing that. I'm going to ask you some other questions as well as I got some questions from some of our viewers.
Oh, okay.
And we're going to ask you those. I think we'll take a break and then we'll come back and tackle those.
Fabulous.
Yeah, thank you. We'll join you in a few moments.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Welcome back to the Winner's Circle. I'm joined by our board-certified dermatologist, Dr. Jennifer David.
Yes.
Always good to have you. You've been helping us understand a lot about how we can stay safe and have fun as well in the summer. On the subject of prevention, you alluded to some clothing that might be more effective than others in terms of preventing and decreasing our exposure? What do you recommend?
So there are clothing lines that have what we call UPF protective factors.
Okay.
Coolie Bar is one. They have a great online website. Soli Bar is another. And you can get loose-fitting shirts, dresses, pants, slacks, caps, some of those like swimwear, rash guards for young kids who want to be outside for long periods of time. And they have this the special property that blocks out UV radiation from the sun. So that if you're very fair-skinned or have a personal history of skin cancer, those are things you might want to invest in. But for everyday use, you don't have to go out and invest in those things necessarily. Wearing loose-fitting long-sleeve t-shirts, hats, glasses, things like that are also very effective.
Even eyewear.
Oh, absolutely. There's something called ocular melanoma. So you can get melanoma from the pigment in your eye, and being exposed to the sun without protective sunwear can increase your chances of developing that.
Now you're reminding me about a gentleman who keeps his boat at the same marina we go to, and he had his hat on. It was like one of those Tommy Bahama hats, you know?
Yeah.
I was talking to him, and he had it strapped so tight to his chin, and I thought, you know, is that a fashion statement, you know? And but I thought, okay, you know, if we're on a boat and we're going forward, then the hat tends to fly off.
Yes.
And but he probably had it on, protecting his skin. Now that you mention it,
Exactly.
yeah,
Yes.
because there's a lot of exposure out there.
Yep.
Now, are there certain colors that we might tend to use more because they're more reflective and more protective in that way?
Correct. So it's more for comfort. Darker colors tend to absorb light. So if you're wearing dark clothes in the summertime, you can feel more hot. So if you want to protect your skin with clothing, in regards to wearing like a long sleeve shirt as opposed to a tank top, you want to make sure it's like a white or a light color fabric that's light and not too heavy. So I would avoid dark colors like black, dark navy blues, and things of that nature.
Okay. I have some questions from some of our guests.
Okay.
And I'll read them. One is that Angel says that, you know, she wants to make sure that we're reminding sisters to use skin protection because we don't feel like we can get cancer. So that was you kind of touched on that. But another question she had was some of the SPF that we use and some of the skin protection we use tends to make us look ashy.
Oh yes, that's a very good point. And that can be a deterrent for some people for wearing sunscreen. It's important to know that there are different types of sun protection. You have your sunscreens versus your sunblocks. So sunblocks are active ingredients titanium dioxide or zinc oxide. They will sit on top of the skin and directly block the sun rays from penetrating. Historically, they've been those white, thick, pasty sunscreens that didn't blend well into brown skin. So we developed these organic chemical sunscreens that have a more sheer appearance to them, and they get absorbed into the skin, and they absorb the UV light and transition it to heat to protect your skin cells from UV radiation. However, over time, technology has improved to where, personally, I prefer mineral sunscreens because I like the idea of blocking the sun. And the less things I have absorbed into my body, the more comforting I feel about, you know, long-term health and safety. Even though all of the sunscreens are FDA approved and safe, I just personally prefer mineral sunscreen because my skin is sensitive as well. The newer technologies do have mineral sunscreens that will blend in well with brown skin. But it comes down to a lot of trial and error. You do have to find the one that not only blends in well to your skin, but feels good going on. My go-to is Aveeno Ultra Calming Mineral Sunscreen. I warm it up in my hands, I work it in, and I can wear this every morning, and it doesn't leave that white cast or that purple hue. And it protects me from the sun.
Perfect. Thank you. And there's another question. Maria asks about an eye cream, particularly for aging women of color. She mentions that her skin is producing less oil and it's showing in her eyes, and she doesn't like the way it looks.
So in regards to aging, when it comes to sun protection, of course, you know, we're talking about skin cancer, and that's our primary concern, but UV radiation does accelerate aging. So if you're not protecting your skin, you will age more quickly than your peers. So I sometimes tell my patients, I say, well, if you're not worried about skin cancer now, if you don't want to look older than your age, you have to start wearing sunscreen for at least vanity purposes. And then hopefully we kill two birds with one stone with preventing skin cancer too. And our skin is different in different areas of our body, especially on the face. The skin around our eyes is going to be very different than the skin on our cheeks. The skin on your eyes, your upper eyelid and lower eyelids, don't have oil glands in general, so they tend to get more dry. So investing in a good eye cream is important. So that's something where, depending on what your concerns are, that's a discussion with your dermatologist. And I do those. I do skincare regimen counseling through my online service, Skin and Scripts. So that's virtual. So I can do Zoom calls with people. They'll tell me their skincare concerns or questions, and we curate a regimen specific for their concerns and their skin type.
Can you run that by me again, your virtual practice, so that our viewers can track you down?
Yes, so it's Skin and Scripts, virtual dermatology. You can log on to www.skinandscripts.com, and I do video consultations to discuss skincare regimens or skin issues or problems. And we also have an app called the Skin app, where people, if they want more convenience, can take a picture and upload their information, and then I correspond via a detailed treatment plan that I'll email to them.
Excellent, excellent. You mentioned some sensitive areas. Kim asked, how about care and evaluation and concerns for the scalp and those sensitive areas of our bodies?
Yes.
How do I know if I need to have this area checked?
Well, that gets checked during your routine skin cancer screening. So when I'm doing my screenings in office, I start from the scalp, work my way down. I do it the same way on every single patient, so I never miss an area. And it starts with parting the hair or looking through the hair of gentlemen, because we can, anywhere we get sun exposure or even anywhere you have skin, you can get a skin cancer. So that's an area where sunscreen needs to be worn as well. If your hair is thinning, you have to get some sunscreen and spray it in the part, because I have detected many a skin cancer in the scalp. Hairdressers are our allies. A lot of patients will come in and say, my hairdresser noticed a spot, can you evaluate it for me? So have a discussion with your hairdresser. They're very astute, and they're looking whether they mention it or not.
Sure.
But as a patient, you could be your own advocate and say, have you noticed any moles in my scalp? Just to prompt them, say if they are busy or maybe forget to check or look. So our scalps should not be neglected. If you have thinning hair or a part in your hair, if you're outdoors and not wearing a hat, wear your sunscreen, or just wear a hat and stay protected that way.
Excellent, excellent. You know, you're reminding me also that when I go out and it's a great day, it's nice and sunny, more likely to take off as much clothes as possible, put on a tank top, shorts, and no socks if possible also, and really expose my sun. I've been doing this pretty half-heartedly, I mean, just kind of not really paying attention. I have to be more mindful.
And we should enjoy the weather. We should enjoy outdoors. I encourage people to get outside and be active. It's just adding the extra step of awareness and protection. So as long as you're protecting yourself, I love the beach. I just sit under the umbrella. I wear my sunscreen. I enjoy the water. When I get out of the water, I reapply my sunscreen. So you're not supposed to deprive yourself of fun in the sun. Just just be aware and protect yourself.
So we talked about cancer diagnosis and prevention, and also aging. Anything else we need to be concerned about with just exposure to the sun during this times of the year?
Sunburns are important.
Okay.
So they can be very, there's different degrees. So if you have like a 3rd-degree burn, then that could make you prone to infections and things like that. So keeping that, and those are things that we keep lookout for. Other sun-related, outdoor summer things we'll see is like poison ivy. So you want to make sure that when you're outdoors, so not only wearing sunscreen, but avoiding those leaves of 3 that can cause
leaves of 3.
Yeah, so avoid those. Bug bites are common. Making sure that you're protecting your skin, and ticks for pets and animals, making sure that you're guarding your pets with flea and tick prevention, so you could avoid getting those little critters on yourself.
Yeah, no kidding.
So when it comes to skin care in the summer months, it's sunscreen for skin cancer prevention, anti-aging, prevention of sunburns, but then also these other factors, because we are where our skin is exposed to the elements, and that includes things like rashes from poison ivy, and exposure to things like ticks and
Yeah.
other arthropods like mosquitoes. And
Wow, lots to think about, actually. Yeah. Well, you know, you've taught a lot here, and I really appreciate everything that you've offered.
Thank you.
I
It's
know
a
that
pleasure.
I know that our viewers will be tracking you down, several of them, because you've offered so many details and so
Yes.
much, such a volume of information that
Well,
we
thank
can
you.
really use. Going to offer you the floor to take us home there.
Okay.
Maybe a final word on skin care for the season?
Yeah, so it's the summer, so enjoy your time outdoors and all of the beautiful weather, but protect yourself and make sure that you are avoiding the sun during the peak hours and protecting your skin when you are having your outdoor activities with sunscreen, hats, and adequate protective clothing. And make sure you see your dermatologist at least once a year so we can do our skin cancer screenings and evaluate your own skin once a month when looking in the mirror and at any moles that you may have to make sure that they're not changing. So we talk about those A, B, C, D, E's of your moles, or just looking for that ugly duckling or that new spot that had developed. And an ounce of prevention is really worth a pound of cure, so I can't hone in enough the importance of just wearing your sunscreen and reapplying.
Excellent, excellent. That's very worthy information. Thank you so much for offering that, and thank you for coming on into
You're
the
welcome.
Winter Circle.
And
once
lastly,
again.
I'd like to offer the best way to reach me or to find out where you can either do an online visit with
Yes,
me or
please.
see me in office is through Instagram. I have a tree link to where if you click on the link in my Instagram, which is just Dr. Jennifer David, you can click on doing a virtual visit or click to see where you can see me in office, which is in Bucks County, right outside of Philadelphia.
Awesome.
Yeah.
Instagram, Dr. Jennifer David.
Correct.
And click on what now?
Click on the link in my bio,
Okay.
and it will give you options to either have a virtual appointment with me or how to schedule an appointment with me in office.
I suppose the person's in Texas or someplace else.
So-
Can you see people in another
I can.
state?
I can treat and see patients in those states where I'm licensed.
Uh-huh.
So that includes Texas, believe it or not, Texas, Florida, New Jersey, or Pennsylvania.
Nice places.
Yeah.
Perfect.
Yeah.
So you know where to find Dr. Jennifer David. And you know where to find us also weekly, Mondays at 2 p.m., Tuesdays at 6 p.m. We will join you every week and offer up more incredible information, such as what we have been shared today by Dr. David. Thanks so much for joining. Share this message with your family and your friends, those that you care about, those that you want to keep safe over the summer. And until we meet again, keep winning, guys. Take care.